Good evening, everyone. We are excited for our interview tonight and sharing the exciting story of our new 2022 ICD Fellow, Dr. Bernard Fialkoff from New York. Before we tell you more about Dr. Fialkoff, I would like to introduce my co-host for tonight, our USA Section President, Dr. Risa Martin. Dr. Martin, thank you again for joining me tonight.
Good evening. Thank you all for being here.
Before we start, please, everyone, use the comment section on our Facebook page to tell us where you are watching from. Leave a comment or ask a question. We will do our best to answer your question if time permits. I would first like to introduce and share the story of Dr. Fialkoff and his background. Dr. Fialkoff, again, thank you so much for spending your evening today with us.
Well, it's my pleasure, and I'm looking forward to this. I want to thank you and Dr. Martin and the ICD for this great honor and giving me the chance to be on Live 45.
So let's learn a little bit more about Dr. Fialkoff. Dr. Bernard Fialkoff, DDS, was the valedictorian of the State University of New York, Stony Brook Dental School in 1980. He was also received awards with the Alpha, Omega, and OKU chapter. He is a fellow in the ICD, which he did receive last month in Houston, and also a fellow in the Pierre Fauchard Academy. He has periodontal and dental implant specialty postgraduate certificate from Memphis VA Hospital, University of Tennessee Dental School. He has been in private practice in Bayside, New York, and his practice is limited to dental implants, laser, and periodontics since 1982. He is also the founder of the Fialkoff Dental Study Club and the Implant Certainty Training Program. He is the president and founding sponsor for Foundation for a Drug-Free World, the Americas chapter. He is a drug-free education speaker and has spoken at 6 United Nations events. He also is a member of the New York State Dental Association's Chemical Dependency Committee. He is a winner of the International Freedom Medal for his drug education in 2016. He had the honor of ringing the opening bell of NASDAQ for Drug-Free World, the Americas chapter on September 15th, 2017. In addition to all of this, he also has time, and he is a producer and founder of a Time for Truth, a TV show. Thank you so much again for joining us. So let's just jump in and get to know more about you and all the great work you do. The first question I have for you is, what is that actually inspired you towards a career in dentistry?
Well, it's a great question. And the answer is my father. His name was Reuben, and he was a Cuban physician. He's such a great example for me, inspired me. And I always kind of knew I was going to go into the health field. And my family, my mother was a pharmacist. We were always helping people. And what I liked about dentistry is I always liked a little bit of art. And in dentistry, I saw science and art together. And I saw it was very challenging. It wasn't going to be something simple or easy, but that actually intrigued me. I'm a guy, like you see from my bio, who likes to get involved in challenges. And so dentistry to me, or all of us as dentists, are unbelievable in what we do and how we try to do such a great job in micromillimeters, and we're amazing people. So to me, that's really what got me involved, is my parents. And 42 years later, I got to tell you, I have so much pride in being I'm a periodontal and implant surgeon, a dentist, and helping people. And that's really how it all started.
Well, Dr. Fialkoff, that's wonderful that you had parents that were so instrumental in exciting you into a wonderful world of dentistry. But I'm wondering what happened or what influenced you to start sharing this information about the global drug crisis that we have?
Well, that has a lot to do with like my background. So I was born in Cuba. And so, like I said, in my mother's pharmacy, my father would come and he would help people free of charge, when he had spare time. And I saw that. And I have Jewish religion, and I'm married to a Venezuelan woman who is Catholic descent. And really, my whole life has been like a little United Nations. I've always liked to meet all kinds of different people and backgrounds. And to me, that's what's so great about the world, is that we have all this diversity, different viewpoints, different beliefs and cultures. Otherwise, it'd be very, very boring. And so, since that was my background, obviously with that background, I realized a lot of things early on. And so I was always looking to see, well, what can I do to change the world? How can I get it to be more open and helping each other? And then what happened is in high school, two of my friends got into drugs and they didn't make it. One was a really great athlete, got a scholarship to a great football school. I won't say too much so no one would know who he is. And but unfortunately was smoking marijuana back then, so he got kicked out. And that to me, the other who ended up dying actually made a big mark and impression on my life. And something important to mention, since we're in the International College of Dentistry, is that 284 million people used drugs globally a few years ago in 2020. And the ages were very diverse, from 15 to 64. And so to me, I feel that we're very lucky that as Americans, we have so much freedom. We have a country that's so powerful. And so we have ability to change so many things. And so to me, that's how I decided to create the change and to move forward.
Thank you for sharing that.
And I think it's really, I kind of, I agree with you. It's really important to make that change. So speaking of change, I know you do a lot of presentations, but what is it that made you give such a priority to presentations specifically on vaping, marijuana, and CBD?
Well, this is something very important I want to share with all my colleagues watching this Live 45. The country needs us really badly. And I'm going to tell you why. All of the scientific studies from our NIH, from our CDC, from the past Surgeon General of the country, and from really all the medical journals, JAMA, New England Journal of Medicine, all of them show scientifically that marijuana and CBD, and vaping are very harmful, and that vaping and marijuana are definitely very addictive and do gateway. It's not my philosophy, and the presentations that I give, I base totally on scientific references, because it's great to have a philosophy for your own life, but when it has to do with other people, you have to deal with scientific truth. And so then when you look at that and you go, well, what's happening in the country then? How is it, what's going on? And that's the importance of our dental profession, because to me, we're like the fathers and mothers of the country, as doctors. And it's important to realize that in 2021, we lost 106,000 Americans And to put that in perspective, in the entire 10-year Vietnam War, 10 years, we lost 56,000 Americans. So in only 1 year, we basically doubled the amount of death rate, and the death rate's been increasing every year. So to me, this is something that's really important.
Well, can you tell us a little more about the Foundation Drug Free World, the Americas chapter?
Sure. Well, there you see a photo doing one of the events, and I work a lot with Globetrotters. And there you see behind me, his name is Robert Z. Hunter Zorro, and that guy spinning the ball is Hollywood Henderson, and there's a few other ones to the other side. This is with the World Conference of Mayors. That's Mayor Johnny Ford on the knee in front of me. And the Foundation for a Drug-Free World is a nonprofit public benefit corporation. And the philosophy is to empower youth and adults so they can make informed decisions and live drug-free. But the thing is nobody likes to be lectured. So the program is based on education and contains booklets, 14 booklets on every drug, 16 public service announcements. They're very impactful, award-winning DVD. And through volunteers like me that are worldwide, 50 million drug prevention booklets have been distributed. There's been tens of thousands of drug awareness events in 180 countries. And the Truth About Drugs public service announcements have gone at over about 500 television stations. So, you know, the program is amazing and it's available. That's something I should mention to all of my colleagues at drugfreeworld.org. And it's free and you can avail yourself of it. It's a great piece of educational technology and really a great resource to use.
Yeah, and we will put that information on our social media to ensure that that resource is available to all our members. Like you said, it's a great resource. Going back to your bio, I mentioned this, and I would like to know more. Is how you became more involved with the New York State Dental Association's Chemical Dependency Committee.
Well, that's, you know, because Dr. Chad Gahani, who was the past president of the ADA, and his wife, Rekha, really have known me for so long. He and I we all started out together. Seems like a prehistoric time, long time ago. So he's known me a long time, and so has she. And I've been doing this for quite a while now. It's about 17 years. So they realized, along with I want to give credit to the people who actually inducted me, Dr. Prabha Krishnan, and also Dr. Jeanette Gomez, who's actually the president of the Queens chapter ADA, and also was past president of the Hispanic Dental Association. So really, they advised me and urged me to get into that to help my colleagues. And it's been a great pleasure. I work up there with Chairman Bob Herzog. We had a meeting about a week ago. And the picture that you have on the screen is with then at that time, Brooklyn Borough President Eric Adams, who is now the mayor of New York. And the man to my right is a bishop from Haiti, who's a friend of mine, who went to Haiti with me to establish drug education. The one to my left is David Tidman, who did a tremendous amount of presentations. And here what he was doing is Eric Adams was presenting Drug-Free World with a proclamation declaring a Drug-Free World Day in the borough of Brooklyn in New York City.
Wow, that's great.
Oh, it was a lot of fun.
Oh, absolutely. And
Yeah.
quite the honor as well. Well, tell me, did the pandemic affect any of this, or how did it affect it, if at all?
Yes, absolutely. With the social distancing, with all the worry, right? The tremendous amount of stress, the worry of not getting the disease, of wondering what you should do. You know, things have gotten much better over the last few years, but initially and for quite a while, there was a lot of stress. Obviously, the economic repercussions have been great. So a lot of people have been very, very affected economically and lost their jobs. Some have lost their businesses, the small businesses they have, which is horrible, and they've gone out of business. And so what happened is worldwide, what happened is we had an increase, and the increase of alcohol usage was at 48%, a 48% increase. And the marijuana usage increased 44%. So the effects were very, very high. The other thing very important to note that really has never been covered in very many publications or really in the media is that when somebody is smoking marijuana or vaping it, and you're talking about COVID, a respiratory disease, you know, it's horrific what the ramifications in terms of public health have been. And no one has really even quantified. I haven't found any study that's quantified how many actually got the disease or even possibly died from, you know, from the fact that they were marijuana usage of smoking, the vaping, aside from all the other factors that we all know as health professionals. Yeah.
Very interesting. And they were probably sharing as well, right?
Well, you know, there's so many ramifications. It's like, absolutely. And then, you know, we wonder why opioids, you know, we were talking before the show between us, you know, amongst us, and really the opioid problem has to do with that, is that as these drugs have increased, then they gateway and segue into stronger drugs, because we all know that when you use drugs, the body acclimates physiologically. And so it seeks to have that high, but you need a stronger drug. And this is why we've seen the increases of opioids, and something that you mentioned at the beginning of the show that we won't have time to go into, but maybe in a future time, fentanyl. Absolutely.
So Dr. Fialkoff, you know, you are a leader when it comes to doing education and all in this area. I would like to know more specifically, like, how did this leadership path evolve for you?
Well, first of all, what I want to say to my colleagues who are going to be watching this in the future, and those of you who are participating tonight, is that, you know, we're all leaders and we all have the potential to do tremendous amount. I just look, and I'd like my example to be of what we can all do. Because if we really ask ourselves, how many of us want our kids, and I've gotten older now, so, you know, I have grandkids, and how many want our grandkids on drugs? And obviously the answer to that is no one. So let me tell you then, and share this question, having asked you that question to really hit home on the importance of why we need to get involved as dentists in this problem, this pandemic of drugs. And at first I ran the program out of the office of my daughter, Megan. And we did it maybe once a week or once a month. And it started to increase. So I decided it was important to do, and I hired someone, David, who I mentioned before, David Tidman. And he went around after school activities, sporting activities, PTAs, educating. And that would happen, increase some more. So my daughter wanted to get somebody who could maybe sing some songs or do some rap. And she found this volunteer whose name is Tamik Williams. And he started going around, and Tamik and David started having a bigger impact. And at this point, what happened is we started getting with the New York Police Department Athletic League. And from that, we started training the school resource officers of NYPD. Eventually, amazingly, we trained all 5,000 of them on the program. The director loved the program, and they love the program. And, you know, from there, it started to expand. And we started doing parades. That's a parade you see on that promotion. And then you see the Globetrotter in the white suit, Robert Hunter. We've run basketball games. And you see my wife there on the float with the dog. It's our dog, Boom Boom. And my daughter is next to her. She's blonde. That's Megan. Next to her is Tanique. And you see the Harlem Wizards. Bobby was there with the basketball. And, you know, you saw the picture with Eric Adams. You know about the proclamation. And being Cuban born, the program started getting reaches from different Caribbean and Central American countries. And we established the program actually in 3 countries with the Council of Drugs of those countries of Guatemala, Haiti, and Dominican Republic. The man that you see up on the upper left of the float is General Nahara, who actually directs the program in Guatemala. He was a former Air Force general in Guatemala. And, you know, so the program really has expanded. And as you said at the beginning, I started to talk at different venues, and the United Nations being one of them. And we've had annual drug-free world events at the United Nations. We're looking forward to having one again in February. And, you know, but what I want to say to those dentists watching this, all of you can do this. You know, when you think about how we are in our offices and how precise we are, it's a no-brainer. I know we can all do it.
You're right. We can. You just have to be committed to it, right? So tell me,
Absolutely, Risa.
what do you feel is your most rewarding experience for you as a leader in this area?
Well, I'll start answering that question by first going over like what's been happening, because with the drug situation, there's been a lot of violence in New York City recently. And obviously there's been a lot of community unrest. And I've been really lucky because it's like God rewards you. And, you know, the Hindu philosophy has what's called karma, and Buddhist, where you create your karma, where what you do comes back to you. And, you know, I can tell you that it really has been so fulfilling, because I've met some great people and a lot of athletes that when I was a kid, I watched on television. You know, I met Julius Erving at his Scranton training facility and spoke with him, met Barkley, Drexler, and, you know, Marshall Falk. Marshall actually is a very big proponent of drug-free world. And, you know, it's just been beautiful because, you know, I can get with people who can do something. And I know as dentistry, we can do this together, which I want to just mention to all of you on this video, is that November 30th at Greater New York Dental Meeting, thanks to the sponsorship of the ICD through Laura Madrano, who organized the meeting. I want to really thank Laura Madrano and Dr. Tatunik, who helped a lot. And through the New York State AGD, Dr. Shakib, who's been promoting it. You can go on the AGD website, sign up for it. It's 3 CEUs. And really, the most rewarding thing for me would be the dentistry saves the country. You know, I know it sounds a little bit crazy, but as dentists watching this, I want you to think about something. If we spend a little time and then we send our assistant or our hygienist out to the community and we educate against drugs, all of the parents will love you. And you will be the go-to dentist in that community. You're going to feel great. And as the dentists do this nationwide, we will have tremendous goodwill from all of the communities. And we will be able to demand the correct PPO fees, and they will listen. We will be able to demand that Medicaid does the right thing, and the politicians will listen, and you guys know why. So my, you know, being inducted in the ICD is a great reward, And I want to say something to this group, because when I've met a lot of people, and you see, I've known a lot of athletes, but I got to tell you something, the ICD I found to be a really high integrity group, not in what the words of it, leadership, service, and integrity, but in everyone that I spoke to and how fast you act. So I know we can do this, and whatever help that everyone needs, I'm here for you and for dentistry, and more importantly, our country. So to me, Risa, that's really the reward, is this great feeling of doing something so important.
Well, thank you for sharing that.
Oh,
And I
it's
think,
my pleasure.
and that passion, I think, just epitomizes why you were inducted at the ICD this past month. So talking about last month, right before the convocation in Houston, you were in Spain giving a presentation. So what has been the response to this information that you have been giving to at different countries around the world?
Well, first, a little levity, because we can't be so serious. So first, a little levity. Now, I happen to be a guy, I'm from Connecticut. So even though I was born in Cuba, I was raised in Connecticut. I'm not really a native New Yorker. So even though I live in New York, I don't know, I still consider myself like a nutmeg guy. That's what it's called a nutmeg state. And I went to University of Connecticut, and I loved our song, Yukon Huskies, similar might to the foe, and then we became a great powerhouse in basketball. And so what was I going to say is this: by helping the community, I got invited to go to Spain, all expenses paid. And I want to thank him, Dr. Talaj, who runs Somos Health First medical healthcare program in New York. And Dr. Talaj heard me speak at one of his events that he invited me to at the beginning. He liked it so much, he invited me to Spain. But the levity is this: the beautiful thing is it allowed me to bring my wife with me. And my wife, being Venezuelan, had always wanted to go to Spain, hadn't been to Spain. So here was a great excuse. I brought her to Spain, all expenses paid, and wow. Now, to answer your question, I spoke to about 1,000 physicians and dentists in Madrid at the Riu Hotel. It was live. And all of the physicians, all of the dentists agreed that they've seen clinically what's been happening with marijuana in their offices. The psychiatrists at this meeting were very happy to hear this talk, because they had been seeing it in their practices, and they thought that it was horrific what was going on with marijuana. And really all the health professionals were in agreement that as a group, healthcare is really the pivotal point in this whole drug crisis. So, to me, going to Spain, it wasn't a job. I had a great time. I got to be honest. We first went, to different cities, and then we went to Madrid later. But it was a great excuse. So if you're looking for a great way to bring your wife, or if you're a woman dentist, you bring your husband, Risa will bring her husband. All we got to do is do this work for the community, and we will get rewarded. So I had a great time in Spain, and what can I say? It was, I got to see it. I had never been there, and it was a beautiful time.
And I think it wasn't work because you enjoy what you're doing, so it never feels like work.
No, you know what? But if you really look at it, and again, I think one of the things that we're missing in the country is acknowledgement. And so I always like when I speak is to acknowledge. And I'll tell you why I'm saying this. It's like, if I didn't have my fellow dentists and my dental suppliers, and I didn't have my dental repairman, I couldn't do anything, because I would have my equipment would go down. I wouldn't know how to repair it, or I couldn't treat my patients. And I wouldn't have colleagues out there doing things at Queens County like Dr. Gomez. So the reality is that all of us really do an unbelievable job as dentists. I think we're a little bit crazy, but the world is very lucky that we are, because we're counselors and we counsel for free. And we're such good counselors because they open their mouths for us in spite of the fear. So I really, I want to acknowledge all the dentists out there, which is why I know in my heart that dentists are the right item. We are the right people to bring drug education to the entire country. And the ICD can be where it started with this great motto. So, you know, I had a great time in Spain. And we went to, also, just to let you know, I went to Barcelona. It's a beautiful city. I encourage anyone to go there. And wow, what a relaxation. So there you go.
Well, that's great. I'm glad you got to take your wife with you as well, for sure. You know, I was always told by my patients that hey, you've got a captive audience. You know, you've got your hands in my mouth. I can't talk. And so I would, you know, that was my opportunity to always share any of my knowledge. So see, we all have captive audiences with this, right? So I
Absolutely,
just have a
Risa.
question.
You know, Risa, you're so right. And that's why, again, also because the level that we take care of our patients is, it just shows about who we are as dentists.
Yeah, yeah. Thank goodness we love to share our information. So I'm just curious, you sound extremely busy. You must have multiple secretaries that help organize your life and all of your different venues that you go to. But how do you how do you manage this responsibility and then still speak around the world?
Well, first, I have to say something. I'm really, really lucky that my wife is there. She was actually director of the Gallery of Art in Venezuela, and I stole her away from Venezuela. And Maria is an unbelievable support. She really allows me the freedom to do this. She supports me and actually does some of what you said, Risa. She does some of my communicating. She does some of my administrative work, especially with the Latin American countries, because her Spanish is a lot better than mine. You know, I left Cuba when I was a little boy and I was only 8 years old. So it was very rudimentary Spanish that I had known. I've increased and improved, but she's well beyond me. So I have her. I was also very lucky to have my daughter at the beginning, Megan, who is unbelievable. And I've really been surrounded by very able people. The Globetrotter, Robert Hunter, is amazing. And, you know, I have so many friends that help with it. It's not just me, and it's made me more appreciative of other people. And now I have the ICD. So, and if I were going to share one thing that I've learned is that when I do something, I realize I should try to finish it and complete it. Because if I leave it on the side, I end up having so many piles of undone work that it drives me crazy. So I want to share one thing is that finish what you start. And even though it seems like you want to go do something else, or you're drawn away, try to finish what you're on, just like we do in our clinical practices. And that's what I've been implementing. Now, before we leave this picture, that's my wife, Maria, on the far right of the picture. And she's holding the booklet. She's got that black and white blouse. That's Maria. And this was with a group at the Somos Spain convention where we were distributing the booklets to different physicians, also some of the physicians, some of the Somos administrative staff, and you know, other people from Madrid.
You know, I always say behind every very successful dentist is a very loving spouse.
You know what? I love that movie. It was a Greek movie, a Greek wedding, and the two mothers and the grandmother are there. The young daughter is there, and she's going to get married. And the grandmother says, "The man is the head of the house," and the two mothers says, "That's right, that's right." And then the grandmother says, "And the woman is the neck," and she turns the head.
I love it. I love it.
So I know how to correctly allow the power to go. And, you know, I've learned that in many ways after being married many years. So Yeah, I'm very lucky.
Yeah, and I think like, a great team that works together is able to achieve a lot. And I think it's shown by just going through all the great work you've done, not only within dentistry, but also that you're doing with the Drug Free, the Americas chapter in the US, as well as, beyond the American border. As we wrap up the interview, Dr. Fialkoff, everyone has some words of wisdom or a quote that kind of defines them, or has helped them to be defined. So for you, I would like to ask, do you have a personal quote that you would like to share with us?
Absolutely. And these are three leaders. By the way, that's Jesse Jackson. And I met him with the World Conference of Mayors with Johnny Ford. And I showed him the drug booklet because unfortunately the African-American community is really beset by drugs. And he was very happy to get the program. So let me share the quotes. One is from really, to me, one of the founders of our country, George Washington. And he says, a primary object should be the education of our youth. And what duty more pressing than communicating it to those who are to be the future guardians of the liberties of the country. And then I want to share from Martin Luther King something very, very, I think, very important. Our lives begin to end the day we become silent about the things that matter. Faith is taking the first step, even when you don't see the whole staircase. And then one from Gandhi to be universal. Be the change you wish to see in the world.
Those are great. So if I were a new graduate, do you have any words of wisdom that you could share with me if I'm just coming out into the dental world?
Well, I'm going to share something that is from when I was graduating, and I'll show you so you know it's really true. And this is Dental Student Magazine. And here I'll zoom in a little bit so you can see. You see 1980. Dental Student Magazine. And I wrote an essay. It was for the Block Drug Company essay contest. And so I want to read something to you for those new dentists who are starting their careers, because the most important thing in anything you do in life is purpose. Purpose and a dream is what gives energy and drives you. So I'm going to read you something that I wrote in 1980. I hope you enjoy it. And it's about dentistry. Here we go. To assume the title of doctor means more than restoring teeth for monetary and personal gain. We have other responsibilities to the patient, which will continue to grow as science and research expand the body of knowledge. Today's dental schools are reaching out and modifying their curricula to include a more biologic and holistic approach. It is up to present and future members of the dental fraternity to build upon and encourage this growth. The time for change is now. We must begin to educate ourselves, our community, and our governing bodies. As I read this, sometimes I go, this is like what I was talking about, and I can't believe I wrote it back then, but let me continue. The course must be planned and not be haphazard occurrences created by the whims of politicians trying for electoral support or greedy businessmen trying for larger monetary returns. It is a bright future if we allow for and continue our development. However, it can be as bleak and pessimistic as those of us in our profession who would perceive of dentistry only as it once was and always will be professed. The choice is ours to nurture or to neglect, to lead or to abandon from fear, to deteriorate as closed-minded technicians, or to arise as true doctors of the oral cavity, to truly deserve and not just desire the title of Doctor of Dental Surgery.
Wow, that's a timeless piece that you have there.
You know, when I was preparing for the show, I remembered it. I looked at it, and as I was reading it, I go, "Wow,
Yeah. It's appropriate for today.
it's amazing!" Right? You know, I'll share something with everybody since I feel so comfortable with the ICD. A lot of my friends call me Buddha. So I'm a Jewish Buddha, you know. So, but and then one of my friends who's a rabbi said to me, "This is Rabbi Lev." He goes, "Dr. Fialkoff, you're a rabbi." I said, "No, I'm not a rabbi. I'm a dentist. I'm a surgeon." He goes, "No, no, no, no. That's because you don't know the definition of a rabbi." I said, "Okay, what's the definition? Come on, give me, what's the definition of a rabbi?" He goes, "A rabbi is somebody who helps people, and you're helping people." So I guess I'm a combination Buddha, rabbi, because if I didn't say I was a rabbi, my mother would kill me. And but that would be my quote for those people who are starting the profession. Keep your integrity. Don't sell out. And if you believe what I spoke about tonight, let's preserve private practice dentistry forever. We're not going to get taken over by the corporations. We can do something about the fees, but God has a very interesting way of working. He's waiting for us to be the fathers and mothers of this country and to lead all the kids to safety and away from drugs. That's what can happen.
And I
Very
think that,
profound, very profound words.
and I think that's a great way to end the interview, and also something that is very touching. I do want to thank you again, Dr. Fialkoff and Dr. Martin, for joining me tonight. For everyone who are watching live and will be watching later on Facebook, please go to drugfreeworld.org. It's a quick few steps where you can actually request a free booklet, and you can get a set of multiple booklets. I believe it's about 24 booklets that you get and that you can use to educate members of your team, your patients, and your community. Because as you saw today, this is a great cause and something that we as ICD members can definitely make an impact and make an impactful change. And I think that is the goal.
And Dr. Thusu, let me just say one thing before we end off my segment. If we look at this, we can unite all the different nationalities, all the different religions, all the different creeds, because all of us agree that we don't want our kids to die or get addicted on drugs. So realize that all that Drug-Free World is an educational product that allows us to not only educate the kids on drugs, but really unite all our communities so that we can form the example for the world and say, you know what, there doesn't have to be bigotry, there doesn't have to be prejudice. We can work together and, it's okay to go forward. So I want to mention that because really the only way this is ever going to happen is if all of us do it. This is not going to be a one woman, one man thing or just one organization. It really has to be out there and prevalent and prolific and expanding. So I'm sorry that I entered this, but I thought it was very important because there's a lot of positive that could come forward. So go ahead. I'm sorry I interjected into your ending here.
Oh no, I think I think the knowledge you have to share, I'm more than happy to share with the members. And I think I do agree with there is strength in unity, especially the unity of dentists who can make an impactful change. And I think a great example of that is what just happened yesterday in Massachusetts, where you had Proposition 2, and that was, a dentist-led effort that made change in the state law of Massachusetts. So don't look no further than just last night of what change you as dentists can make when you come together.
Beautiful.
Thank you again so much for joining us. As I wrap up, thank you again for all our viewers. Just remember, look for our upcoming interview dates to be posted on our USA section website by visiting usa-icd.org. Hover on the events tab and click on the events list drop-down link. All our recordings of our live interviews are posted on the USA section website under the publications tab. We also have a YouTube page where it will be posted. Our next live is going to be next month, Wednesday, December 7th. It'll be a very special one. It's going to be someone I have known since a high school kid, Dr. Christina Miners. She is from Texas and is a practicing dentist in San Antonio. And she won't be our only special guest. We will also have another special guest where I will be introducing our recent inductee who was inducted with Dr. Fialkoff, Dr. Amay Patil, who will be the 2023 Outreach Fellow for the ICD USA section. So we'll get to know him as my time comes to end in this particular position. So I look forward to seeing everyone next month for 2 really amazing guests. And I will see you then. Everyone have a great night. Thank you so much for joining.